I would like to introduce our moderator for the day. I'd like to introduce our moderator for the day, Mr. Harmit Singh, who is a student of Economics and Political Science who graduated from University of Toronto, and he's pursuing his Masters in International Development in Barcelona. He is coming in as outside looking in, so his questions would be very fitting for all graduates or all students who have no clue what the medical science is all about. Without further ado, Harmit, the floor is yours.
Hi, Samu. Thank you so much for attending today's virtual career day, and thank you again to all the speakers. Let me just earlier, Jufitri, the MBM president, he spoke about how there are 14 million youth in Malaysia today, and we have the responsibility to build our country together. And the purpose of education is to develop oneself and to give back, right? And I cannot think of a better career for someone who believes in service and someone who believes in giving back than in the medical industry. And today I'm very glad that we are not only focusing on the sort of established careers or the sort of popular careers in medicine, but are also highlighting, for example, we have a pharmacist in the house as well as a physiotherapist, right? And so let me go ahead and introduce the speakers. Firstly, we have Dr. Wilkinson Tan from Serdang Hospital, who is a specialist and is a OBGYN. And we also have Puan Diyana, who is a pharmacist who studied in Manchester. I'm looking forward to hearing about that experience, as well as she's also working with the PPB, as I understand. And lastly, Mr. Mandeep Singh, who is my physiotherapist and who also has a background in entrepreneurship that I'm looking forward to understand. Right. So let me get into the first question, guys. Why did you choose your field, and what attracted you to the idea of giving back or helping or caring for others? Dr. Wilkinson, if you can go ahead first.
Okay. Sure. So what made me choose this career?
Sorry, I think you're on mute.
Can you hear me? No? Yes? Yep. No?
Yeah.
Are you able to hear me? No?
Yeah.
Yep, I can hear you.
Yeah. I can hear you.
Yeah. Sorry. I'm on my phone because I had to come back to the hospital for emergency case. Yeah. So what made me choose this career as a doctor? It's a career where you care for others, and specifically, why did I? Actually, I'm intrigued in obstetric and gynecology because it's amazing how you can grow a person inside another person. A woman can be pregnant and you can have a child in the body, for 9 months, 10 months, and it's amazing. And that's the human body is wonderful, and I want to care for these patients, when they are not well, and help them gain back their health. So that is the reason why I chose this career.
Wow, I've never thought about it that way. It's framed extremely beautifully, and like you said, the principle is built on giving back. Puan Diyana?
Okay, so I was exposed to pharmacy since I was 15, I think. So every school holiday, every cuti sekolah, I'll be working at a local pharmacy. So the pharmacist there was teaching me how to become a pharmacist. So since then, I have determined that I want to become a pharmacist and help, people know their medications well, because I think at that time, during that time, people don't really know ubat properly, like how many times, how many hours you have to take it properly and such. So for me, I think it's a responsibility as well, and have to work concurrently with the doctors so that everyone knows their medications and their treatments well enough. So hence why I'm very interested to become a pharmacist.
Wow, amazing. Goes back again to
early exposure for me. Yeah.
Right, it's early exposure, and it's the inquisitiveness, right? It's going out of your way, finding out what you like. Mr. Mandeep?
Just like Diyana, I had the exposure of physiotherapy since I was a very, very young kid, because both my parents are physiotherapists. But however, it did take some time for me to develop some interest in physio as I was growing up. I got to see a lot of people coming to the clinic and etc. And while I was choosing my career, I thought not physio because it'd probably be mundane. But then I suppose I did spend some time before I picked physiotherapy, and I did the liking of it because I started seeing more people, and it was more of a people thing where you get to spend extra time to speak and actually find out about their well-being in a day, you know. So that's why I then picked physio.
See, and that comes back to the fundamental principle of being. This is a people-centric industry. You're caring for someone, and it's it's totally wholesome. Yeah, I think there's no better way to describe the industry as a whole. Okay, moving on to the second question. How would you describe your time in university? And let me just switch the order again. Mr. Mandeep, you can go first.
So I picked Manipal University as an adventurous feat. You know, at that point of time, and in 2009 was when physiotherapy just started in Malaysia, and they just offered diploma and etc. But I think I was more keen into looking into a degree program right away. So I shipped myself off to Manipal. I enjoyed my university days. I had Malacca Manipal students with me over there in Manipal, but mine was a 4.5 year degree over there. So extensively, I had the exposure of having Malaysians, foreigners. I had locals from India who became my patients. So I learned a new language. So the exposure of leaving the country was a little bit of a dynamic change for me because I got to experience more. I got to learn more about cultures and learning about things in the hospital in Kasturba Medical Center. You got to see more cases where you probably wouldn't be able to see in a private center or local hospitals. All the complications and etc. All in all, the social and the study life was very different compared to what I would have gained in Malaysia at that point of time. And that's why Manipal for me, university life was interesting, a lot to do.
Would you do most in terms of physiotherapy, right? Is it the most established program in Malaysia, the Manipal one?
Manipal one was an option because right now they've got many universities in Malaysia who have come up with a degree program and master's program. So back then, UKM and UITM were the only universities that were offering physiotherapy full-time degree. And then now you've got MASA, you've got APU, you've got all these other universities who are now offering physiotherapy. And establishment in Malaysia, I suppose, yeah, it's very, very much building up. INTI universities also coming in and etc. So the exposure is becoming vast right now here in Malaysia.
Perfect. It's actually, if anything, it's a good time to get into the industry as well.
It is definitely.
Dr. Wilkinson. Yes, thank you, sir. Dr. Wilkinson, how would you describe your time in university?
So I graduated from IMU, International Medical University. So as a medical student, this is the time that you need to train and pick up all the skills that you need to function as a doctor. Because the reality is, the day one you start working, there's already a lot of expectations that they have on you. You're expected to examine the patient, you're expected to draw blood, take blood from the patient, do minor procedures. You must have to be able to do all these things. And the only time that you can learn this is as a medical student, which is something that my uni did push, encourage, and demand us to do. So we were not allowed to be in the university between 8 a.m. to 5 p.m. So between 8 a.m. and 5 p.m., we must be in the hospital. We have to be in the wards, doing something in the ward. Doesn't matter what you're doing. You can be changing bed sheets for all the care, but you have to be in the hospital. So, but the medical school time is the time where you're supposed to sit in the hospital, take bloods, do some suturing of some wounds, go to operating theater and assist. Unfortunately, it's something that not many medical students do. Most of them think that, what, medical students, I want to read my books. I just want to read my books and pass my exams. But so that's something that I suppose I need to inform everyone. If you do want to go into this career, you have to spend your time in the hospital. So there's a very famous old doctor in the past. His name is Osler. The doctor also used to say, to sail what was he saying again? Let me think back. To study medicine without seeing patients is like a sailor who doesn't go to sea. So how can you learn something without seeing the patient? So you have to spend a lot of time in the hospital. So for me, my medical school years was actually staying in the hospital and trying to pick up as much skills as I can. Sometimes I'll come back in the evening, I'll go into OT, I'll stay back, just to get my hands, probably lacking better word, to get my hands dirty and to put my hands in and dabble into these things, because you really do need to have experience. It's like you're trying to become a mechanic and you don't touch a car. What's the point? You can look at books and look at them. You have to get your hands dirty, put your hands in and do it. And the only way to actually do it is by sitting in the ward and hanging around and seeing patients. That's how you catch things that happen. So that was my medical school life. Basically, sit in the hospital every day.
I actually, whenever I go to the hospital, I'm very impressed by how it's a very well-run machine. I don't think there are other sorts of industries where, especially in the hospital, where everything is, it's kind of decentralized, everything works on its own. And like you said, I think there's a bit of a misconception when it comes to medicine, where it's notoriously known for being, you've got to stick into the books, you've got to study all day, you've got to read your textbooks, but it's also a very hands-on, education experience. But at the same time, there is this stereotype that, kalau you want to do medicine, memang susah lah. It's going to be a terrible 3 or 4, 4 or 5 years. Do you think it's a fair judgment of the entire medicine education?
Well, I think that's an unfair judgment because it's not 4 to 5 years. We're talking about 10 to 15 years actually. All right. The pathway to become a doctor is actually really, really long. First of all, you must have to put your pre-university, either your Form 6 A levels or something like that. After that, you have 5 years of formal medical school. After 5 years of formal medical school, you have on-the-job training for the next 7 to 8 years. And in fact, your training doesn't end until the day you retire. You have to always update yourself with new medical stuff, new surgery, new drug. You have to keep training, non-stop training. Yeah, and it's
always
long hours.
An ongoing thing. Yeah?
So
it's long hours as well.
Yeah, of course it is.
Yeah, you work long hours, and even on weekends, most of the time, Saturday, Sunday, you'll be sitting with your books. Monday to Friday, you're working. Saturday, Sunday, you're studying. But that's the life.
So when you describe that, and the very fact that you are in the hospital right now, I cannot help but think that it sort of becomes an identity. In most careers, at least it's like a 9 to 5, and then you leave your job, you go back home, and to be a doctor, you become a doctor. It is your number one identity of sorts. How does that work for you? Like, how did you realize that, or did you know that from a young age? I want to be a full-time, doctor. What was it like?
Yeah. So there's a joke I always tell my friends. Doctors always marry 5 groups of people. You either marry another doctor. All right, you either marry another doctor, you marry a nurse, you marry a pharmacist or a medical assistant. Maybe you marry a drug rep that comes and sells drugs to you. You know why? Because that's the only people you know. That's the only people you see day in, day out. Of course, there's some who go out, venture out of this as well. But it's something that you have to realize this is your life before you step into medical school. If you're a doctor in the government side, you're talking about 36 hours on call. You come in on a Monday morning, you're going to stay in the hospital until Tuesday at 5 p.m. You don't go back. You're going to stay there.
Yeah.
And on average, you'll be doing this at least 5 to 6 times a month. Sometimes more, sometimes less. But that's how you're going to do. You're going to sleep in the hospital a lot. Even if you're in private side, you do have to come back on weekends. Most people have weekend off. Friday is party day, Saturday, Sunday. But for doctors, it's not so. You sometimes have to work on Saturday, on Sunday. And it's the same with pharmacists as well. They have on calls as well. But that's how it is. You have to be prepared to come back and spend time in the hospital. That's the life.
One last question before I move on to Diyana. But have you, in your time when you were studying, did you have colleagues that were not ready to give that commitment? And what happens? So, like, if students out there who are thinking, I kind of want to do medicine, but I'm not ready to give up all of this time, what advice do you have for them?
Okay, so as a medical graduate, it means you graduate the medical degree. There are 5 careers that you can actually venture into. One is to be a clinician. Clinician sees patient like I do. All right, you see patient. Number 2, you can go into academic. You become a lecturer. You teach. So If you're a lecturer, you probably have more time because lecturers don't have classes in the weekend and on the evening. Number 3, you can go into hospital administration. You can become the hospital director and run the hospital. So time is a little bit more stable as well. Of course, you can go into things like work for a drug company, you sell drugs, you know, then your time becomes more of a marketing person, but you use your medical degree to help you boost your knowledge. Now, even if you are a clinician, there are many pathways in medicine. If you choose a career like ONG, definitely you're going to have more time in the hospital. Let's say you don't want to spend so much time in the hospital, you can choose things that don't really have much emergency, such as, let's say, dermatology, ophthalmo, eye doctor, skin doctor. You don't really have that much emergency, so you don't really need to come back to the hospital on weekend that much. But if you do something like surgery, obstetrics, then, well, that's the life they have committed to. So choose the right career path beyond your medical degree. That would be my advice.
Okay. So for everyone out there who wants to do medicine and have the doctor at the front of your name, but not ready to commit the hours, become an eye doctor, right?
They're also very busy. They're also busy.
Not as they are also busy. I'm not saying they are very free.
They're very busy.
I'm just talking about, relatively, they might be a little bit not so busy.
I suppose, yeah, that's true.
Read between the lines. Read between the lines. Okay, next one, Diyana. How would you describe your time in
So I graduated from University of Manchester 2013, if I'm not mistaken. So I mean, I don't know whether you guys all know this, but UK life is a bit different. They really focus on work-life balance. So even in universities, they will instill that already. So I used to go to the hospitals because of course we are a pharmacy graduate at that time, so we need to have a hospital training and such. But they will make sure that everyone will leave by certain hours. So I think for that exposure in Manchester is kind of like a shock when I got back to Malaysia. Because in Malaysia, you have to spend hours you have to be there by 6 and then have to go back a bit later than everyone else. Even though you have to clock at the right hours as well, clock out. But for me in Manchester, I mean, being a undergraduate there for 4 years, it's definitely they impose us on learning on social skills, all those things like basically how you talk to people. They even have exams on that. They have actors coming in. So and there's a year where we have to take 1 whole year a course of volunteering course, any type of volunteering like a river cleansing or helping giving food to homeless. So all those kind of things is like not just, you just don't learn pharmacy there, you have to learn being a human being as well. So I think it's very important on where you choose as well to study, because it will expose you to other things in life. So basically in Malaysia, they'll focus you on more like what Dr. Wilkinson say, like he's being a doctor, they will expose you to being a doctor from the very start. Like Mandeep, he is exposed to all the Indian cultures as well there. So for me, I'm being exposed to a UK culture, or like a British culture, where they will, for them, like work-life balance is important as well as social skills. So without those things, they know they people cannot survive.
Yeah. I think maybe I'd like to add, when it goes into the Western world, people do have more of that work-life balance.
Yes,
when
exactly.
it comes to the Asian continent, it's 8 o'clock clock in, no time to clock out. That's it.
Exactly.
So let me pose this question to both Diyana and Mandeep.
Yeah.
So your colleagues that studied in Malaysia, right? And
Yep.
so the big difference is obviously this culture of work, right? But apart from that, in terms of the technicalities, would you recommend going abroad if you are, if you have the opportunity? Maybe if you want to go first, Mandeep, and then Diyana.
Oh, yeah. Actually, I would recommend people to go abroad to study physiotherapy because, see, the thing is, these are the countries, the countries out of Malaysia are the ones that established way before. So the exposure, the lifestyle, the work-life balance, everything is trained into you before you come into Malaysia and really start Going abroad would definitely give you the best exposure because I mean, let's not, I don't want to condemn anything about Malaysia, but I suppose that it's also in our education system that people are being spoon-fed nowadays, you know. The students who come to me right now, they are being spoon-fed notes and etc. But over there in abroad, we were literally given the thick textbooks to open up and read, you know. From there, we will know the author and all that. Exposure-wise, you'll see all kind of things, you learn new things, you can make new friends from overseas. So going abroad is always going to be the benefit of what it is, the epitome. And when you come back to Malaysia, then you bring that whole benefit of what you've studied and learned and, you know, cultivated, come back to Malaysia, and then you expose yourself for those things. So going abroad, yes, definitely, if you get a chance.
Perfect. Diyana?
Yeah, same thing for me. I mean, going abroad, first thing first, you will learn different culture. So that it will instill on you that culture that, you know, for me, it's the work-life balance, the one that you come shop at 9 and you go back at 5, etc. But at the same time, like NHS, which is the UK healthcare system, it has similar as KKM, because I think we were exposed to UK's life from the very beginning because we are British, under jajahan kan, Inggris. So basically, NHS almost as similar as KKM style as well. So being exposed to NHS and KKM is not that much difference other than their work-life balance, where they will not let you work until a certain hours unless there's emergency cases, and that's it.
Yeah.
But being there, the pharmacists society are stronger there. So the voices of pharmacists listen more in comparison to Malaysia. So we have more job scope. That's what I'm trying to say there. Yeah.
So what I hear from that is also all sorts of exposure in your career and while you're studying is extremely important, right? Be it when you're studying or be it when you are working as well. If you have the opportunity, do try to go abroad. Do try to go, try to have different types of experiences because it can only help.
True.
Definitely.
Definitely.
Okay, so on to the third question. I think this is a very important one. What are job prospects like, and what is the average starting salary? Dr. Wilkinson, if you want to take us away with that.
Okay. So all medical graduates, you have to first do 2 years of housemanship, or called house officer. 2 years of house officer is equivalent to being an intern in other fields. So once you completed your 2 years of intern, then you can fully register to become a doctor. So what's the starting pay for an intern? You have to work with the government for that. It's approximately 4,000 ringgit pre-tax. All right, that's how it is. Then if you continue working with the government, you will have an increment fixed table of increment over the next couple of years as it goes up. I think there's some viral picture that goes on internet now about the pay of the doctors. Don't look at the maximum pay, look at the minimum pay. All right. So the pay goes from 4,000 to 9,000. You do not earn 9,000 when you first come out. You earn 4,000. That's the minimum pay. Now, what is the job prospects? As I mentioned earlier, there's 5 career pathways you can take: clinician, academician, administration, going to marketing for drug reps and all. You can also choose, if you're going to clinician, you can choose between all the different fields of specialization. You can be a radiologist, ophthalmologist, radiologists do CT scans, they do X-rays. You can be an eye doctor, you can be a bone doctor, you can do surgery in the bowels, you can do brain surgery, you can be a obstetrician, I mean take care of pregnant women. There's a lot of field you go. So if you become a specialist, or of course you can either choose to be in the government or be in the private side. Government side, you tend to have a fixed pay, but and you'll be working in the government. Your pay will be much lower, but you'll be serving the poor community, of course. You get more exposure because you'll be seeing a lot of cases. If you choose to go to private, you'll be paid according to your consultation. So the more patients that comes to see you, the more money you make. The more surgery you do, the more money you make. You'll be better, of course, in monetary, but your patients tend to be from the middle class and the higher class as well. So it really depends on what you want in life. Both career pathways are good, and everyone has their own choices to make in these two.
This is an important point, I think, in Malaysia's, at least in the labor market for doctors in Malaysia. So we all know that there's been an increase in the number of doctors, right, in the supply of doctors, and there is a demand, yet the industry hasn't quite caught up with that. So what about people who think, oh, there's so many doctors now in Malaysia, I shouldn't do medicine because I'm not going to get my chance to specialize or whatnot?
Well, there will be chance to specialize. The way to specialize in Malaysia is there's two pathways. One, most specialization goes through a master's program, where you have to apply to join the master's either in one of the various government universities in Malaysia. Some specialties such as internal medicine, obstetrics, gynecology, pediatrics, they have an alternative pathway. We can do a UK paper to become a specialist. Now, yes, the market is getting a lot. There are a lot of doctors coming out now, but that doesn't mean there will be a job. There will be a job, but you will not be filthy rich. You know, perhaps in 50 years ago, if you're a doctor and you open a GP clinic in your town, you are the richest man in town. You know, it's like you drive the Bentley or Rolls Royce around because you're so rich. But now, when you are a doctor today, you probably will not be able to drive a Rolls Royce, but I suppose you'll be comfortable. You might be able to drive a 5 Series BMW, stay in a nice house, not a mansion, but a nice house. Not comfortable, but don't become a doctor because you want to make money. That shouldn't be your goal. If your goal is to make money, choose a different career.
Yeah.
Do you think, so a lot of like the current number of doctors, like the large numbers, do you think a lot of them have been we've been misguided by the fact that in our previous, in the previous decade or so, to make money means you have to become a lawyer or a doctor or an engineer, and there wasn't as many options. Do you think there was the reason why that there are so many, like some of the reasons why there are so many doctors currently?
Well, undeniably, there will be some who join for the wrong reason. Some who assume that you become a doctor, you get a lot of money, because that's a very common misperception people have. They think that doctors make a lot of money. Doctors do make a certain number of money. They are quite, all doctors are comfortable. You will not see a poor man doctor, right? But it's rare, it's not common to see a doctor who is filthy rich,
Yeah.
So there will be people who join for the wrong reasons, people who came in wanting to save the whole world. But that's not how it is. And perhaps after they start working and they realize, then they will start to change into other careers.
Awesome. Noted. Okay, moving on to Diyana. What do you think of job prospects and estimates for average starting salary?
Actually, it depends. Like for pharmacists, we do have two pathways for starting as well. But for those that are working with the government, we call actually both government and private. We call provisionally registered pharmacist, or PRP. It's like a houseman doctor as well, but we only have a 1 year attachment. So basically, the salary with government is almost the same, about 4,000 with the doctors. Or if like my doctor friends, when I was doing husband, they were doing husband as well. They were comparison. They were like, oh no, pharmacists are making more money, a little bit more money when you guys are husbands. But doctors get more increments in that sense. But other than that, we do, I think about almost 10 years ago, government do this new thing for pharmacists where we can do it, we can register or do housemans privately. So when we do privately, I think the pay is less as well. So so it depends on which type of industry. So pharmacists, we do have with the government, like being a pharmacist, government pharmacist. Even in government, they do have enforcement. They have the one that studies clinical, NPRA, or Bahagian regulatory pharmacies, all this. But other than that, in private, we do have the retail pharmacists, or like Caring, Guardian. Those are the big names, big pharmacies. These are the big names. Other than that, we do have industrial pharmacies where you work with the manufacturing company, or like, for example, you work with Pfizer as a pharmacist here, attached to here. Other than that, you do have like a medical sales rep as well. So other than doctors, they will get a pharmacist or a chemist as well. So yeah, there's a lot of branches you can enter. It depends on what do you actually like.
So in recent years, at least in the last 5 years or so, some pharmacists have been getting a sort of bad rep because of like big pharma and etc. Is that some sort of is that image in Malaysia present as well?
The big pharma, well, it depends though. Not really, because even as a pharmacist, we are not really well exposed here in Malaysia. A lot of people knows if you go to Bandar, they will definitely know what is pegawai pharmacy or pharmacist. But if orang kampung, if you go outskirts, I worked in Kuala Lumpur before when I was with KKM. So they don't really know the function of having a pegawai pharmacy there. So those kind of things. So for your example, for the big pharma controversial, so it really depends on where you are. If in Bandar, they do know about the controversy or Lanza, but we are not that affected because they still believe in pharmacists and such. Yeah.
But at the same time, the industry is quite regulated, right? So it's not
Yes,
like
very regulated.
you know, compared to
You
like
have
the US.
to, if you go everywhere around the world, it's very, very well regulated. It's the same thing as doctors as well, because it's not simply you can get a license in Malaysia. Doesn't mean you can work everywhere in the world. You still need to take exams there. Because we need to know their laws as well. So yeah.
Would you say that there is some potential to increase the reach or develop the industry further? So if like there's an entrepreneur who wants to set up pharmacies for maybe luar bandar, right? Is there an opportunity for someone with an entrepreneurial spirit maybe?
Yes, definitely. There's an opportunity, especially luar bandar actually, because it depends on like for pharmacists, if you want to open in Malaysia, what I would suggest is if you want to open your own retail, find where there's a clinic, because there are certain medications doctors are not allowed to dispense without a pharmacist. So that's an opportunity. If you can make friends with the doctors that open a GP there, you can definitely make a business there as well. So that's one way of it, seeing it. Yeah.
Okay, thank you so much. Moving on
Welcome.
to the next speaker. Because this is like a sharp contrast lah. Because the next speaker is an entrepreneur in his own right. But I'll get to that later. Okay. To answer this question.
Yeah.
What are the job prospects like, and what is the average starting salary for a physiotherapy?
So, okay, there's a little bit to know here. We definitely earn lesser than a doctor and a pharmacist lah. But we do need to know the know-how of how the medications work in a human body. So we need to know pharmacy. We need to know all the pharmacological medications and etc. We also need to know whatever the doctors do. So we are actually in the allied health branch. Okay. Now, for myself, yeah, I'm also doing entrepreneurship. But now talking about physiotherapy per se, just physiotherapy solely, the pay in Malaysia right now ranges depending on your diploma or your degree or your master's. So the range is about 1,008 to about 3,005. And it also depends on the work experience and the years of experience that you have with a certain institution or a company. So these are then where the variations come in. As per etc. and added advantage to doing physiotherapy is that we don't have a regulation that is set yet in Malaysia. So we have an association. We have Science Persekutu coming in, and we are already in the process of having a regulation body that's coming into Malaysia. And by which maybe in 2-3 years time, we'll probably have that whole housemanship thing, and then moving on to physiotherapy as work experience and etc. So that's in the process in Malaysia. Like I said before, that it's actually very new in Malaysia. So a lot of things have to still be in the government, governance of trying to get this profession into its place and etc. Now coming to private. So now the minute you move in from government, let's say you're doing government, you've got a certain spec of salary, and when you move into private, now you've got the know-how of how to work with business, marketing, you get to go do house calls, But right now, of course, with COVID, you've got a lot of restrictions and a lot of things that goes down. Forgetting COVID for a while, we see that there are better job opportunities if you are readily available to open yourself up to a lot of things. So a lot of physios are also doing part-time nursing, part-time business, part-time this and that to actually generate more income in their professions. I suppose physiotherapy also needs to create more awareness because the misconception here is that, physio equals to massage. And that's something that we don't do, it's only like a 1% thing that we do in physiotherapy. Now bringing to the youngsters to talk about physiotherapy, whoever likes sports, whoever is into Olympics and etc. right now, you will definitely see physiotherapists there working with the sportsmen and all that. So it's a range of womb to tomb. You know, we take care of babies, we take care of people in the ICU. So the range of its spectrum of physiotherapy is actually very wide. But the misconception and the awareness is that, oh, physio equals to massage. So a lot of things to create an awareness about lah.
I've got two follow-up questions. Okay, the first being, so the like actual day-to-day or the sort of like, because you say there's a sort of lack of awareness, right? What do you want people to know about physiotherapy?
Physiotherapy is not massage lah. That's number one statement. I'm sure Dr. Wilkinson and Diyana know about this as well. Secondly, what people need to know is that physiotherapy has a wide spectrum. So people with stroke, people with women's health, post-labor, people with Parkinson's, people with cancer, hospice care, respite care, pediatrics, you know, everything comes into the spectrum where physiotherapies are helping. That's why we are under the allied health sector. We are very much working with the pharmacist, the doctor in the multidisciplinary unit of any medical field. So we need to know everything.
I honestly feel like, unfortunately, or rather it's a bit of a, so this is a combined question lah. Number one, do you think the speed of the regulatory body, right, as it's being developed, is it fast enough? And number two, is the industry, in terms of awareness, is it increasing fast enough? If somebody joins in, if somebody starts studying physiotherapy today, will he be or will she be in the middle of of a growing industry when they graduate?
Definitely. Physiotherapy is a growing industry. It does generate a lot of income if you have the proper planning behind it. Coming to the regulation and all that, of course, it's speeding up because people are now getting into the know-how of what physiotherapy is all about. Doctors right now and pharmacists right now know that physiotherapy is a long run for a lot of rehabilitative, restructuring, and even getting back to daily life lah. So we see a lot of things of that way. So regulation is definitely working its way up.
Perfect. And I think it's we have this paradigm earlier, like that is I think a bit old school, where we think of medicine as saving lives, right? But actually medicine is care. It's all sorts of care. There is, for example, even making sure people can be as productive as they can be, taking care of the entire human body.
Exactly.
That is the entire philosophy.
Yeah. So I would classify doctors as, yes, saving lives, generating a good health, pharmacists to maintain that, but physiotherapists, we add the quality to life. That's how I think we work hand in hand together.
I really like the last sentence. Okay, on to the next question. How would you describe working in the public sector compared to the private sector? Dr. Wilkinson, I understand have you had any exposure with the private sector, and what do you think of the two?
Okay, so I have not worked in the private sector yet. I'm still working in the government sector, but I do have a lot of friends who work with the private sector. So in the government, there is a hierarchy that you are within a hierarchy system, meaning that you have people above you, you have your senior doctors that will guide you and help you if you get into trouble, and you have your junior doctors who will help you and you will help them if they get into trouble. So in a way, working in the government, you have a lot of support and a lot of backing. Now, when you go to private, you are very much on your own. Do you have friends? Yeah, you might have friends who will help you. Let's say, oh, I'm not well today. I want to go for a holiday for a week. My friends can cover me. But you are expected to be of a certain level where you do not need to be covered by a more senior person anymore. That's why in order to go to private practice, you should be competent enough to have self-practice, independent practice. So that's the difference between government and a private. And it really depends on which career field you're going into. If you're going to a career field that's a bit busy, like I said earlier, obstetric, gynecology, surgical, if things happen on a weekend, if a patient suddenly comes in labor on a Sunday, you got to come back. If a patient comes in labor in the middle of the night at 3 a.m. in the morning, you got to come back because that is your patient. And they expect your care, personalized care. If you work in the government, you are actually divided into different days where you're on call and not on call. If you're not on call, means you go home, you don't have to care about patients in the hospital. But if you're on call, you stay and take care. So because you have a team, so you divide out your days. So your time is a little bit more predictable, but in private, less predictable. Of course, in private, you get paid more lah.
Okay. That's a big point lah. But what about so you said that there's a lot more support in public. Private, you have a lot more responsibility. In public, private, you have to be on call differently. What about in terms of the culture? Because we have this perception of public hospitals being overworked. Is it fair to say?
Well, naturally, in government sector, you don't get to choose your patients, so people will just keep coming in. So yes, there will be more work in the government sector, but of course you do have your team as well. You have a bigger team, but you do have more work. You get more severe cases because most of the time you have an emergency, you go to the nearest hospital, which tends to be a government hospital. Private, you tend to have less severe cases, and you get to choose to a certain extent, you can choose your cases. So the workload is definitely a bit less in private compared to government. But then again, government side is when you're working in the government is when you train. So you do want to have that workload so that you get to have more experience and to train more on that.
Very, very good point lah. Especially if you're a young doctor, right? Why would you, if it's your identity and you want to be really good at it, it's best if you go into the public sector.
You have to invest your young age, your youth time to spend time working and training, so that you can reap the benefit later on.
It's a lot of dedication, and I have a lot of respect for people who do that. Puan Diyana, how would you describe the difference between public and private?
Okay, so basically I had exposure working with government, working with a private hospital, and as well as a retail. So it depends. Like for me, when I was working with a government hospital, of course, like Dr. Wilkinson said, we have a team. We do have a team, so it's easy for us to take a break or anything. The responsibility lies on all the team. So we have but when I went into a private sector, we do have a team as well, but also any responsibility also lies on you. So, and of course in private you work more as well. So for example, where I used to work, we do have to alternate over the week. I think alternate every other Saturdays, but in government you definitely can have your weekends. You might have to work one weekend in a month, but in private you do have to work 2 weekends. So you can see that there are more workload in private hospitals as well, because they don't really have a lot of pharmacists there in private hospitals. For retail, yes, that is where all your responsibility lies on you, because that's your license. That's basically your license. So when I was working in a retail, it's an independent one. So it's just a sole pharmacy. So yeah, it depends where you work as well. So those are the different types.
There is, whenever I go to the public hospital, I see like these posters about, treating staff in the hospital, right? Do you think, is there, have you ever come across like issues where maybe the staff, like what is do you, in a public hospital, because you see a lot of patients, is there ever a chance of being overwhelmed compared to in the private hospital where, it's very orderly, maybe, you have maybe infrastructure to handle patients?
So I think we probably, with the government hospital is more of like, because in a day we'll probably see 3,000 to 4,000, and I don't think COVID we might cause less patients coming in. But when it was my time, I went to a district hospital. It wasn't even a central hospital, so you can imagine how many people in central hospital will see. Yeah, Bandar punya. But I was working in Hospital Banting, but my patients about 1,000 or 2,000 or 3,000 a day. So even then we do feel overwhelmed. Yeah, especially if you work with outpatients. So that's because in pharmacy we do have a patient coming in every 1 month, coming back for the same ubat. So if we give them certainly a bit later than 30 minutes, they will start questioning our competency already. Like, why is so late? Why you don't know my medication stuff? This kind of things, of course. Yeah.
Demanding.
Yeah, very demanding.
Yeah. And I wonder if it's just a Malaysian thing. But I mean, yeah, we definitely like, we express our dissatisfaction whenever like we have to wait for a bit or queue up, right?
Yes.
Quite unfortunate. Okay, now on the other end of the spectrum, so Mandeep, you are working currently in the private sector.
In the private sector, yes. So we get the exposure of, like I said earlier, that we got this exposure of working in the corporate, we work in the field, on the field with sportsmen. So I suppose when you are in the government, because I've got friends in the government working there, most of them are only in a certain department, like someone in the ortho, only ortho, someone in neuro, only in neuro. But the mixture of the rotation happens more often in the private because we get all kind of patients coming at one go. Of course, there wouldn't be a choice of choosing the patient then and there because we're working collectively with the whole team. So we get pharmacy, we get people with stroke, neuro issues. We get people with women's health issues. So the only difference here is that the preference of the patient choosing the therapist. So if it's a female, the female will be like, I want to see a female therapist. Or if it's a male, the male goes like, I'm not so comfortable with a female therapist. So then we have the option of choosing the gender based on the patient because we're spending more time for those patients, And yeah, I suppose that's how it is in the private sector. In the government, however, the only exposure I had in the government was because when I was studying, I also had to do the internship for 6 months over there. And it was a very, very, very grilled, literally every day was like grilling. You enter at 8 o'clock, you get to see like, you as a therapist get to see about 15 to 20 patients in a day. And by the end of the day, if you don't complete it, you get a complaint from the management that, oh, how come this physio has not seen this patient, so and so. And I suppose the government setup is such that that I'm talking based on the foreign law. But Malaysia, my friends usually clock out at about 5 or 6, unless they've got an overtime to work on. That's how it is.
If you gave a figure of like 15 to 20 people in government, right? You had to, you had an estimate for the number of patients you see today, like in the private sector?
In the private sector, every therapist is entitled to at least see a minimum of 8. That's how then you churn your own income, because if you're getting lesser, then you will have a little bit more free time. So by then we are giving them, we're giving more of this off things to do, like marketing, gotong royong, clean the center, because that's in the private center. Yeah, in the government, you've got all these cleaners there already. So when they're free, I suppose not much going on there, unless they've got to do an extra learning, extracurricular, CPD stuff to work on. So a lot of R&D is in place as well right now in physiotherapy. Yeah.
Okay, now let me go into some specialized questions, and let me start with Mandeep again. I'm very interested in the answer to this question. How type opportunities for entrepreneurship in your industry? I know your father had set up the business, but you have
yes.
a totally different level as well. How was your journey like? And maybe you can provide a bit of background to those who don't know that.
So it was like this: that parents set up the clinic and etc. But in my figure of time now, it was trying to create the better awareness to people by creating infographics, getting the social media running, getting the know-how of how the clinics are running, getting the whole setup. So once now we're entering into corporate life, what's happening is that we are getting more influences from outside to, come in, help us with our enhancement of the centers, get referrals from doctors, So my job right now requires me to be in the office to see patients, but also extracurricular to really try to run the clinic around, to get the advertisements out and all that.
How would you like to make that jump from, being like the technical aspect to going into administration and taking care of finance and all of those things?
I suppose it does take, you will take time to learn this, because experience is key over here. It's not something that is imbibed into you. You don't go into a job and go like, okay, I know this, I know that, because if I have to do that, then I probably have to do also finance, MBA, and all these other courses to actually learn this. So, sometimes we even enter into medical legal background. So we've got hospitals and all that who need physiotherapists to come and give their opinion, a fair share of opinion. We'll need to give our expert opinion on how the patient needs to go by their daily lives. We'll need to talk about their daily activity of living and how much they will need to get from an insurance compensation, things like that. So right now, I think I've branched into so many things that when I want to bring these things together, it's not so difficult because I've spent over 6 to 7 years now to really learn the know-how of it.
Very nice.
Yeah.
Very nice.
Yeah.
And it takes that sort of vision, right, to be able to grow that, to be able to grow opportunity. But if you had advice for an entrepreneur in the medical industry who is probably already a doctor or whatnot, what advice would you give that person?
Not doctors per se, because I suppose they have their own they already have their own set of understanding. But to anyone who wants to venture into entrepreneurship, be open. Most of it, be open to learning new skills, be open to understanding another profession that you're trying to pull in, be open to attaining more understanding and knowledge, based on what you're trying to concentrate on. Try to make it more innovative and creative. That's what I would put in.
That is very cool. I wish I hope to be an entrepreneur one day as well, and I will.
I'm sure you will. I'm sure you will.
Taking that to heart. Puan Diyana.
Yes.
Your role at the Pusat Pemberian Vaccine. I'm very curious because we have this perception that it's mostly doctors or volunteers. What is a pharmacist doing in this position?
So it's funny because I volunteer as a pharmacist. There we're allowed to do consent together with the doctors. So when I was approached by the company that was handling the PPV, one of the HCOs at PPV, so they approached me to become the store pharmacist instead, because I can actually work there every day. So I was like, okay, why not? I give it a try. So now I'm being a store pharmacist there. I'm one of the person allowed to receive the vaccine every day. So we have to receive the vaccine at least by 7 a.m. That's the latest, because by 8:15 or 8:30 they want to start administering the vaccine already. So that's one of the things that we do. We have to keep the vaccine. We have to make sure the numbers that went out and whatever that remaining in the store is tally. So if there's one missing vials, it's already under us. So other than that, basically we just maintain the temperature of the vaccine. So all those things that you see, the technical stuff that being explained to the publicly are being maintained by the pharmacist or being dispensed by the pharmacist, all that such. Yeah.
So in a pandemic, pharmacist is probably the most important person or the person in power.
Yes, that's the reason why people are angry at NTRA. Why it's so slow in approving Pfizer and such and everything? But yes, yes.
Okay. Another. I'm going to indulge myself a bit, lah.
Can.
So what are your thoughts on ivermectin, for example?
Oh my God. Okay, I'm totally against it. That's it. I'm very simple against ivermectin. That's it.
Okay, awesome. Another one.
Basically, as a pharmacist, as a doctor, as a pharmacist, we not just following the books, but we also read clinical data, research data being presented to us. So ivermectin, the clinical studies are still being conducted. Even the regulatory bodies are saying it's still being conducted in 12 hospitals, if I'm not mistaken. So I just wish the public knows this and just relax, take it easy, and wait until the conclusive data come out for you to take such things. But black market, there's a black market for it. So
very scary.
Yeah, it's very scary. So if you love yourself, if you love the health of yourself, if you have to take care of yourself, try to avoid taking ivermectin.
Can I just add on to this?
Yeah, sure.
We do have a treatment that actually is proven to work. It's called vaccination. So
yes, exactly.
Why are we abandoning things that work and chasing after the things that we don't know may or may not work? So why not just let's focus on things that work, which is vaccination. Let's just get everyone vaccinated. If you get your vaccination date, go and vaccine. Don't have to choose. Every brand is good.
Yeah, exactly. So true.
Yeah.
It's part of our gossipness lah, and we want to like find a solution or whatnot. But I agree, you know, knowledge production requires a significant amount of time, requires a lot of research and data gathering and analysis, and it may change in the future. But for now, let's stick to what we do, right? Another question, alluding to what Dr. Wilkinson said. It's a bit of a shallow question lah. But what do you think of people who are choosing, Pfizer over AstraZeneca and the other vaccines?
Oh, okay. We do have patients like that. I mean, we do have patients coming in. Oh, because my place we're giving Sinovac. So, but surprisingly, it's not that many people choosing any other vaccine. They'll just take it anyway. But for those patients, they will definitely give us reasons. For example, like you have a few students or maybe like PhD students coming in saying that they're going to States or UK where Sinovac hasn't been approved yet, so they're not sure whether they can enter if they just take Sinovac. So those kind of people will accept it. But for those who rejected like this vaccine for no reason, or like, oh, I want to feel superior other than that, we're just giving them the side eye. So like, there's no such things. So as a consenter, usually what we do is we convince them either way to just take it anyway. So don't worry about it. It's better to get yourself covered first, because you're not sure if you decided to reschedule yourself, you're not even sure when you're going to get your first dose again. So it's better to get whatever being given to you, because at least you're covered. And for, we are covered with first dose first, and then once you get within 3 weeks or 4 weeks, you will get your second dose. So at least you are being covered with vaccine. If you're being choosy, you might not get it as soon as possible as you demand. Then you'll be angry. You say, "Oh, government, you're not giving me my vaccination schedule yet," and everything. It actually is your fault for rescheduling again. Yeah.
Agreed. But I have to say, I'm very proud of Malaysia. I think we have stepped up our vaccination very well. We have heading in the right direction.
Yes.
Right. Would you like? What would your last comments be about like just the general vaccination mission in Malaysia? Are we on course?
Yes, we do. We are on course, definitely. I mean, like for us who works at PPV, I think, I don't know whether you've seen any of your friends, but it's a lot of hard work. It's a lot of dedication, and for most of us, seeing people coming in, it's enough. Seeing the numbers are being injected, like coming in to get themselves vaccinated, is proud enough in our eyes. So seeing that how many people, I think about 85% now in Klang Valley has been administered. Yeah. So seeing, it was so proud. Yeah. Sorry, my kids are around.
From all of us, Rakyat Malaysia, thank you so much. You are at the front lines. We appreciate your effort. Incredible amount. Really do appreciate you.
Thank you so much.
No worries. Dr. Wilkinson, what stood out in your journey towards becoming a specialist?
What stood out? That's a very good question. Okay, I think it's the whole experience of being a doctor. So what stood out is every time you see a patient who comes in unwell, and then you are able to discharge them home well. That is something that they will really remember. Significant. Of course, you always remember the worst and the best. So the best is when you have a patient who's very unwell, come to you, get treated, and go home. You feel very happy. Of course, you remember the worst as well. When one of your patient dies, something bad happens. Those are the things that you're going to remember as well. But it's all part and parcel of the journey as a doctor.
Incredible highs and really low lows. How do you deal with it?
I suppose you do need to have some level of mental strength. You do need to care for your patient, but you must be able to dissociate yourself from them as well. You cannot hold on to the feeling and go, let's say like your patient unfortunately dies. Okay, you need to realize that you're not God. You can't save everyone. You're not going to come and save every single person that comes to you. The most important thing is focus on the bigger picture. The bigger picture is you care for the patient. That is what we are here for. We care for the patient. Inevitably, some of your patients will die, but you cannot have this feeling of, oh, my patient died, and then you go on for the next 1 week not eating, not sleeping. You do need to have that type of mental strength to be able to care for them, yet understand that it's not your fault when things go wrong. I mean, when things don't go not wrong, but things don't go beautifully well. You know, patient don't get well and patient pass away for some reason. Sometimes it's not really your fault, and you have to dissociate. You have to dissociate, otherwise you won't be able to survive in this career.
Yo, it's a harsh reality, lah. And would you, what advice would you give to young budding doctors who maybe have not really reconciled with this reality?
I think you need to choose this career with the right reason and right mentality. You shouldn't come into this career thinking that you'll be very rich, because you won't. The amount of time you put in is not worth the money you get paid anyway. You might as well go do business or something. You get paid better. Number two, you must come in with the right mentality as well. You're not here to save every single person. You're not, as I mentioned, you're not God. You're not going to save everyone. You will have patients dying. Sometimes you just can't save them. You know, they come with cancer. What are you going to do? You can't save everyone with cancer. You're not God. But you can care for them. So you have to console yourself that, yes, you have done your part. For example, for a person who have cancer, have died with dignity. You give them that they have no pain, they have got their last wishes, you know, they have some dignity when they pass away. You have done your part, you cared for them. Perhaps a patient who comes in after a severe accident, let's say, they broke their spine, they can't walk anymore. You can't magically make them walk anymore, you know, you can't do it. But perhaps you can give them back some form of normalcy in their life.
Send them for physio. Send them for physio.
Yeah, send them for physio, exactly.
But
So you have to have that mindset, lah. Don't go in with the wrong mentality. I want to save
That's
life.
true.
So you get depressed, you know, if you think I want to save life, and then you go in, then you realize that your patient died. Then you be thinking like, oh, I'm a failure. I failed to save a life. But you need to focus that, remember, that is not the purpose. You're not there to save everyone. You just there to, but you have to care for everyone.
The main thing I'm getting from this, right, is that there's a lot of respect for the human being in this industry. You know, there's a lot of, like you said, dying with dignity, or even returning patients to some degree of normalcy. That is extremely important. And you know, like I am proud, lah. I'm proud of the profession, even though I'm not. Okay, but we are running out of time. But my last question, I want to know some brief thoughts from you guys. What is your most favorite, and least favorite thing about your job? Diyana, if you want to go first.
I'll go first. Okay. I think my least favorite one was I think I don't know. When I was working in public hospitals, we were attached to all the wards. I think that's the most least favorite part, because I'll be seeing like Dr. Wilkinson Tan was saying just now, the patients dying. I mean, of course, we are human beings. We will not like seeing death in front of us. But being a pharmacist, being a doctor, that's what we will see. So I think that's my least favorite part of being a pharmacist. But of course, my favorite part is teaching people, or making sure people understand what are they taking, what are they putting inside their body, and seeing how their life or quality of life improve. Like Dr. Wilkinson saying, like for a patient with cancer, they may be at the end stage of life, but we need to make sure giving them less painful experience, less for all those things. So yeah, those are my favorite things being pharmacist.
Very well summarized. Mr. Mandeep.
I suppose mine plays around with more of how the patients are. My least favorite was, of course, losing a patient, because we literally spend almost 1 to 2 hours in a day with patients. And of course, like how Dr. Wilkinson said, you know, you're not supposed to be emotional and all that, but ultimately we do get attached to these people, and we do get to know their know-how. And when that void comes in because of their loss and etc., you know, the patients' family members will be like, oh, so sad, these people have gone and all that. But the part where I love is that it's a very spoken profession. You get to speak things out, you get to learn more things, you know, you get to experience more advices from these people. And we're not seeing young people alone, we're seeing all the elderlies with all the experience, and VIPs who come to us and they'll tell you your know-how. So it's a very interactive profession, which I love. I love speaking about it.
Very nice.
That's
I can see that.
the love and the dislike, yeah.
Dr. Wilkinson. your most favorite and least favorite.
So my most favorite is when a mother sees their baby for the first time, they always have a very happy face. That is the most favorite, and that's the reason why I'm in this career as well. The least favorite is the amount of time I need to spend in the hospital away from my family. So many weekends I don't get full weekend. I don't get the Saturday, Sunday. I get the 1 day off, those kind of things, public holiday. And the amount of time I need to sit and with my books studying, I think that is the least favorite part of my career, unfortunately. Well, I mean, I look at my friends and who are not doctors, not in the medical field, might be enjoying themselves, going for holiday, going out on weekends, running around, spending time with their family and doing fun stuff, but I'm stuck studying for my exams, studying to advance my skills in certain aspects. I think that is the part that I don't like, but well, what to do? That is part of the career.
Wow, it's very intense being a doctor. Like how you describe the highs and the lows. It is, yeah, I have a lot of respect for all of your professions. And with that, I think it's a very good note to end this session. Thank you. Do we have time for Q&A? Yeah. Okay. So we have time for Q&A. Okay. And I think there are a couple of questions in the chat box. We can go through this in take a minute or so. Right. Okay. So the first question, and anybody can take this, right? What kinds or types of personalities a person should have with the hopes of making it in the medical field? Dr. Wilkinson?
I think, yeah.
Yeah. You need to have some level of discipline, because you need to have commitment to commit and sit down to study, So you have to have commitment and discipline.
So, okay, another one. Which institutions in Malaysia accept international medical students? I think Diyana or Mandeep.
What kind of institution? What does it mean? Meaning, if you want to work with the government hospitals, they accept. I think for pharmacists, they do have a list of approved universities that you have to go into to work in Malaysia, because that's how you get your license. Without going to the approved universities, you cannot enter government hospitals,
for
even private.
For physiotherapy, it's mostly Malaysians first. That's the regulation. So foreigners can't really come and practice unless they are in the special work life or something like that, but more into business, not practicing. Clinician, mostly lecturers and all that.
Yeah, so for medical, the Medical Council of Malaysia actually has a list of hospitals, universities that is recognized. So with those degrees, you can actually go directly in. But if you're not for one of those universities, you actually need to do an extra examination. You need to do some extra paper to get the qualification to work in Malaysia.
Oh, interesting. I did not know of that. Okay, the next question. If you could turn back time, what would you say to your past self before venturing into your career?
Wow.
A very philosophical question to answer.
I think for me, I'll tell myself to focus more on chemistry. I love chemistry, but being a pharmacist, chemist is everything. So just, in high school, I was a bit playful when it comes to chemia class. So I think I will just focus on chemia, but still become a pharmacist now. So I'm okay.
Very good advice. Mandeep?
I suppose I would tell myself, okay, just be persistent, because there were a lot of variations of studies to have, all kind of spectrum. So I suppose persistence would be one thing I would tell myself: be persistent with what you study.
Dr. Wilkinson?
Yeah, I think I'll tell myself that just focus on what you're doing, and things will work out.
Yeah.
So the next question is, what kind of toll does death of patients have on your mental health? But I think we've explored some parts of that as well.
Yeah.
It's a bit of a depressing topic to talk about. The next one.
Not so depressing, not so depressing. We should take it with a pinch of salt, but of course, with all the experience that you gain from that person, mental health is something that we should always keep in mind. It can get stressful, but you need an opening and outlay of things. Keep a hobby, keep something to make yourself more engrossed in life,
Yeah.
Don't get stuck in the hospital.
Yeah, don't get stuck in the hospital. Go for a walk.
And I want to echo what Dr. Wilkinson said earlier as well. make sure you have some sort of disassociation. You know, you're not God. You know, you're not a divine power.
Yeah,
You gotta
that's
take
right.
things as it comes, right? Okay, the
Yeah.
next one. How do you explain to a person who doesn't want to take their vaccine because they're afraid of the ingredients inside the vaccine? Diyana, if you wanna,
Sorry, what was the question again?
if you had the opportunity to talk to a anti-vaxxer, for example, what would you say?
Oh wow.
Oh no.
Okay. Anti-vaxxers are very determined people. So what we're just, even if you counter back with the information, they will not listen. So what we do is instead of I mean, we can give them more and more data, whatever, because I think they're more like if those are afraid of the ingredients, if for example if haram and halal ingredient, usually we experience that even with normal medication. So we do explain to them, we do take the patient the information leaflet and say this is all okay for you to take. There's nothing to worry about. So if the patient are convinced, they can take. But you know, being an anti-vaxxer, usually they are very determined that they do not want it.
Yeah.
So yeah, even if you go clinical data, they will use some clinical data that are not proven
And my
to
father
counter. Yeah.
told me that.
Yeah.
Is the rate of just a quick question, is the rate of anti-vaxxers in Malaysia high?
No, it's not.
Not so
Yeah.
high.
I think misinformation isn't as prevalent in Malaysia.
Yes.
There's also a question.
Surprisingly, this is not new, but urban people are more anti-vaxxers than orang luar bandar.
Really, yeah, betul,
Yes.
betul,
You know,
betul.
like we like to think of ourselves as orang bandar, we know a lot, but then
Yes, exactly. Orang,
It's
yeah.
it's the WhatsApp forwards that come to you that astonish you, you know.
Yes, exactly.
There's a question about ivermectin. We've discussed this. Please just take your
Yes.
vaccine now. Don't look.
Yeah.
Yeah.
And the last question. Upon completion of medical school in Malaysia, are fresh medical graduates allowed to work as housemen abroad, or is it compulsory to finish the 2 years here in Malaysia? Dr. Wilkinson.
That's for doctor.
Right. You can actually work overseas. You can go to any country, provided the country recognizes your degree. Otherwise, you have to go through the whole thing of taking certain examinations to get their qualification as well. And as far as I know, at the moment, not many medical schools actually recognize outside their primary medical school. They only recognize their country most of the time. So, for some example is, of course, I think I'll miss out a few as well, but the one I can remember now is University Malaya, University Kebangsaan, you can go to Singapore to work, no issues. If you graduate from Monash, you can go to Singapore, you can go to Australia. Can you go to UK to study? To work? Yes, you can. I have friends who graduated from IMU as well, and then they're working in the UK now. You just need to do their licensing exam.
Yeah.
US, you do the US MLE.
Yes, Emily.
In United Kingdom, you do the PLAD. So you do the
Yes,
licensing exam, you pass, then you get the license, then you can work there. No problem. You can work in any country as long as you pass the licensing exam.
Perfect. Mandeep, I think because you've gone abroad, you've studied abroad as well.
Yeah. Again, when you come to Malaysia, now the regulations are coming up, so you'll have to just join in. And if you are a foreigner coming to Malaysia, like I said, you only can do more of non-clinical, more of only teaching. But if you're going abroad somewhere else with the regulated body country, that's where you have to do a licensing exam, like Australia. So most of my friends have gone to Australia. They'll have to sit for a licensing exam for them to actually get into physiotherapy to practice there in Australia.
Yeah, I think that's only fair. Malaysia requires it as well. It's part of the international system.
Of course.
Yeah.
And we're working towards it. Yeah.
Yep. Thank you so much, all of the speakers today. That is our last question.
You're welcome.
This was very insightful, and I'm very glad we had a diverse panelist as well. Thank you so much for sharing.
All right.
All of the youth out there who are thinking about doing medicine have learned a lot. And I want to thank BIMBING as well for providing us the platform. All right. Bye, all of y'all.
Thank you.
Take care.
Thank you. Bye.